Hello, I'm Dr. Patta Radhakrishna. I'm a gastrointestinal and laparoscopic surgeon at SIMS Hospital, Vadapalani. And today I shall talk to you about jaundice. Jaundice is a condition where the eyes are yellow, the urine is yellow, and it's a very common symptom. And this is something which we see very commonly in clinical practice. You should understand that majority of the jaundice is benign, not a thing to worry about, and this due to two viruses, water-borne viruses called virus A and virus B, virus E, and these are usually self-limiting. They do not require any special treatment. They become all right on their own. A few other viruses, namely hepatitis B and hepatitis C, are little dangerous viruses, and these one acquires by blood transfusions or using needles used in another person, and this is something which one has to look into, and these require treatment of a very aggressive nature. I am a surgeon, and I should tell you that few patients with jaundice may not be having medical jaundice. They may be having jaundice requiring surgery. This is called surgical jaundice, and this is due to either patients having stones in the bile duct or some tumors in the biliary tree, namely in the pancreas, bile duct, or gallbladder, and so on. So no jaundice should generally be ignored. Any patient having a jaundice should see a doctor, and they should have blood tests done, and blood tests will show whether the jaundice is medical or surgical, and then subsequently an ultrasound scan or a CT scan is required to see whether it's surgical jaundice. If it's surgical jaundice, then a surgeon like me should see the patient and then decide whether surgery is required, and if it's required, what sort of surgery, because some surgeries may not be very major, but some surgeries are major and requiring some very special skills to do it. And when these surgical jaundice is diagnosed very early and treated properly, most patients become all right. So, ladies and gentlemen, please don't ignore if somebody has jaundice. Please don't go to a non-allopathic doctor. You should go to an allopathic doctor who does blood tests, does scans, and tell that this is a simple jaundice or not a simple jaundice, whether it is surgical jaundice or non-surgical jaundice, whether it requires surgery or no surgery. And then there's no point in coming too late to a surgeon when they will not be able to do much. Thank you so much.